is an Evergreen Media Network studio production.
Hi, welcome to Silver Linings. I'm your host, Janean Barrows, sometimes co-host. That's my role today. And today I am sitting with Mike Conway of Conway Financials and the Royal Fund Management team. And he has brought into the studio our guest, Jeff Meyer, who is with the McCall Agency Insurance. And we are going to talk today about not only what it means to have a healthy wealth, which is our normal conversation with Mike, but how that ties into having a good health insurance policy that fits for you, your family, and your company. And so Jeff is here to kind of talk about that and what that means for us as individuals and us as business entities. But before we get into that, first and foremost, thank you for joining us today, Jeff. We appreciate your time this morning.
Thank you.
And thanks for Mike coming in. You know, last time we didn't get to be together because I had the, but we're all better now and in the studio. So Jeff, tell us a little bit about your history. How did you come into working with personal and private entity insurance?
Actually, there's a couple things involved with that. I've actually known Ron McCall, who owns the agency, for probably 35 years. So we go way back.
Nice.
As long as I've been in Vero. And but secondly, I obtained my health insurance license many years ago, and he was looking for some help on the health insurance side, and I gladly joined him a few years back, and I've been doing this health insurance at least 6-7 years now, and prior to that, all financial services related.
And what did you do? You did before you said financial related?
I'm a former banker. I was back in the early 80s. I was a banker.
So you understand the value of the dollar.
Yes, absolutely.
And you're really going to put some effort into that balancing of what you're going to get for it.
So I have a commercial lending background for probably 15 years. And then in the past 20 years, I've also do financial services. And in the last 5-7 years now, it's been all health insurance.
And people think, well, what does health insurance have to do with your wealth, right? But Mike.
Yeah, that's actually a very important question because most people going into retirement, the two things that are probably the most important for them are what they're going to be charged for health insurance and health care and taxes. And the two things that they don't think of at all are both of those. So I can't stress enough how important that is to plan on your health care. So, and I'm sure, Jeff, you probably have a lot of different stories involving somebody being shell-shocked.
Yes. A lot of people, the two issues there also. A lot of people that go into financial bankruptcy are because they lost health insurance or can't afford it.
And they had to
declare bankruptcy for that due to medical reasons. And then secondly, there's still millions and millions of people that are not insured. And I just don't understand that whole mentality in the overall scheme of things. I've had insurance my whole life.
Well, one of them could be the costs of insurance. The other, and maybe you can shed some light on this too, I kind of was going to get this a little bit later, but how things change from year to year.
That's true. You got to stay up in the regulations.
It's definitely complicated.
Yes, and over the years, you can imagine people that do have the health insurance and they look at their plan each year, it changes. Deductibles change, co-insurance changes, co-payments change, out-of-pocket changes.
So would it be fair to say, Jeff, that a person who's comfortable with their health insurance ought to come in and talk to you anyway?
Yes, I was just going to suggest that as well. Good point. Even, an annual review at a minimum.
Would we call that like a free consult?
Yes.
They'd come in and have a little conversation about what their needs are versus what they have.
Correct.
And like a service comparison.
It's good to do an annual review, even on the health insurance side.
I get questions from my wife because I was in the health insurance business for a long time, but I have to tell you, it kept changing so drastically. I couldn't keep up with it, so and do the rest of my financial planning business. So I send everybody to you.
Well, thank you, Mike. I appreciate that.
But the point is that my wife would ask me questions on a regular basis. Oh, I think we can get dental insurance, or I think we have vision, and they're, I don't know if we do or if we don't. And so I have no idea. And
I'm laughing because I've been visiting my parents, and I hear conversations all the time like, this was covered, and now all of a sudden I'm paying $700 for this. And they're a little older. They're on the Medicare side of things. But yeah, they're constantly dealing with the shifts and change of what's covered, and did somebody put in the code correctly? And it creates a lot of conversations.
Absolutely.
Just like that.
Yeah,
What do we have? What are we getting for that?
Yeah.
And why isn't it working?
Well, some of the things are not necessarily negative. I mean, you work with Blue Cross Blue Shield, right?
Yes.
Florida
Yes.
Blue, they get called.
Yes.
And but they came out with some new things that are positive, right, this year?
Yeah, they and the one thing you do want to compare and contrast is they're basically, and specifically Blue Options and Blue Select in Indian River County. I do cover the whole state of Florida for that matter, but the Treasure Coast, and the plans all differ depending on which county you live in.
Yeah,
so that's another thing you
want
want to make sure you've got the correct plan for the correct county. But and the other thing I want to always suggest, or my job is to make sure that the physicians, the doctors, the nurses, anybody that you see in that plan accepts the plan that you're talking about. And then secondly, that the prescriptions are covered, because they all include prescription drug coverage. And you want to make sure that, are they included in the plan, and what do they cost, and what are the copays on those two? So,
right, because you can kind of switch around on the formularies, right, for different plans?
yes, and those wouldn't necessarily, they always change, but they change annually up to, every year you get another report.
And is it still true that a person that maybe might be on a drug that's not on the formulary can solicit and maybe get it put on the formulary?
Yes, and in
that's
that
a great
case,
question.
there's a couple issues there. You go to your physician and ask him or her, can I, if it's not covered, can I do a special needs? And they do get it covered. Secondly, you can go to the pharmacy. And thirdly, you can potentially go direct to the company, the Pfizer or whatever, whatever company you're dealing with, and they might make an exception for that if it's not covered, and then add it to the formulary.
That's great information for the average individual, to know that the initial decline isn't the end of the line.
Doesn't mean they'll cover it, but you've at least got an option.
But there's
there
another way to exhaust some options.
And then, again, diabetes, you name it out there, that the drugs can cost a lot of money. And so you want to check into that.
And people get other issues as time goes by, right? So they might not have had an issue when they signed up, but now they do.
Correct. That's another thing.
Yes.
I've got a lot of people that are, either not taking anything or generics, and then they might, something might come up and a prescription comes in, and you're like, oh, thank goodness I have this in place. So it's covered.
Nice. That's interesting. I know that. So tell me, on your side, Jeff, you'd mentioned something that we have seen. A terminal diagnosis comes into play, and they have a minimal insurance plan. And then they find themselves having to liquidate all physical assets to accommodate the financial needs for this new diagnosis, to battle it, to fight it. And unfortunately, we see families and loved ones going down financially while they're fighting together to achieve a better clinical outcome. At those moments, money is not important, but when we come up out of those waves and we can catch our breath, it becomes a very important factor, and especially in the recovery of the family and the individual. And so what would be a suggestion on how to avoid those things and how to not get into that pitfall? What would you say in
I would say right off the bat is that's why we have life insurance. So sometimes you deplete all the family fortunes on situations just as you described, and it happens all the time.
Yes.
That's why you have a life insurance plan in force. So you can recoup the losses. Nobody wants anybody to die to recoup losses, that's for sure. But that's the reality of things.
It's additional trauma after.
Yeah. So, I mean, nobody wants to leave the family destitute. I can talk to people I know who have been terminal, and that was their biggest. I
hear that in conversations in homes often when there's terminal diagnosis.
But the problem, too, is in that category is that people wait too long before they try to get their life insurance, and now they can't get it because they have an issue. So the whole idea is to get insurance when you can, which But all that being said, that's another show, another thing. We're dragging the coffin through the living room, but maybe you had a good health insurance, that would never happen.
Yeah, that's true too.
Yeah, but the point I was trying to make is that yes, you're right. When we're not prepared with a proper insurance, that sometimes it becomes very devastating financially on top of clinically. So when we talk about insurance, there are seasons for everything in life, right? There's a healthcare season in Florida. We know that. Some people call it snowbird season. There are financial seasons. There's insurance seasons. There are time frames that are restrictors and constraints for a lot of different industries. And insurance is one of them. We see a lot of government restraints in time frames and timelines. And that is something I want to get into when we come back from our commercial break. So we need to do a little message from our friends on the commercial side, and we'll be back right after that.
Good.
Hi, I'm Eric Flowers, your Indian River County Sheriff, and we are hiring immediately. Get involved in an exciting career and help your community thrive. Featured on Reel's Channel's show On Patrol Live, the Indian River County Sheriff's Office is committed to keeping our neighborhoods safe. Open positions in law enforcement, dispatch, and corrections include benefits. Visit ircsheriff.org for more information. Get your new career started today.
Step into the heart of New York City's secrets at the Yankee Tavern, where every drink holds a story and every patron has a tale to tell. From the depths of conspiracy to the heights of comedy, experience a thriller like no other. Uncover the secrets lurking in the shadows of the Yankee Tavern. Yankee Tavern opens on the Waxlax stage at the beautiful Riverside Theater in Vero Beach on March 19th. But you don't have to wait. Get your best tickets now at the box office or riversidetheater.com.
Welcome back. That's Painless, and we're always grateful for our commercial sponsors. But we also want to say a special thank you for our Silver Lining sponsors. Without them, we wouldn't be able to bring you the positive messages here on the Treasure Coast. And so a big thank you to Rooney and Rooney and the legal team over there, as well as the team at Conway Financials, helping you keep your wealth healthy. So we were having a conversation with Mike and Jeff about timelines and how things have seasons. And we were briefly getting ready to talk about the season for health insurance. So, Jeff, do you have a season?
I would say yes, we do. And it's as far as the different names, but it's Affordable Care Act, aka Obamacare. They call it open enrollment. So there is a time of the year from November 1st through January 15th that you are able to switch plans, change plans, add plans, switch into a different plan that if you don't have coverage or if you want to change the coverage you're in. So that 75-day window is when you can do it on the individual health insurance side. And on the Medicare side, it's from October 15th through December 7th. And that's, you get the ANOC, they call it Annual Notice of Change. You get the book, it's about this thick, on your plan. So that time period is when you are able to switch from one Medicare plan to another or one Affordable Care Act plan to another. And again, like we were saying at the beginning of the hour, how the plans change, the annual review, that's the time to do it. If you want to switch plans, that would be the time to do it. So the thing that gets a little frustrating is when you're out of that open enrollment period, you don't have a whole lot of opportunity to switch, but you are able to do it.
What kind of scenarios can you switch in?
There are a few, and if you move specifically from one county to another, or from out of state to here, to Indian River County or the Treasure Coast, that would be one move. You lose your job, or you lose, switching coverage. Let me backtrack. You lose your job, that would be another open enrollment, or special enrollment, they call that. And then the third thing would be if you lose your coverage. You lose your job and or your coverage. Say, I need health insurance now, so that would be an opportunity. You've got to do it within a 60-day time period, but that would give you the opportunity to switch to another, or go from the group coverage to the individual coverage, so you're at least covered. And like I was saying before, there's so many millions of people that are still have no insurance, and this would be the time to get that. Well,
so there's some qualifying events, but they're limited. And
yes.
So that is something to pay attention to. I know in the Medicare, some of them also have that ability that if they get admitted to the hospital and have a new diagnosis of sorts, that they can go back and make some requests then too. So there are definitely hopes. There's definitely hope for individuals who have a change in their clinical
Correct.
needs. So don't give up hope. Reach out to somebody just like yourself, an agent that's qualified, who's got some experience, and who's able to guide you in the right direction.
But, there
Mike,
wouldn't be another
say?
one too, right? With people turning 65 at a pace outperforming any other age group, I think. But those folks, there's no timeline for them. Is that correct?
Yeah, on the initial enrollment period, when you're turning 65, there is another 7-month window. So thanks for bringing that up, Mike.
Yeah.
Oh.
3 months before your birth month, actually in 2 weeks I have my birthday, so it'd be 3 months before. So January, February, March.
So this is going to be a process you go through.
Yes. And then April, and then May, June, July. So there's a 7-month window that you can actually enroll when you're turning 65. Okay. And that's one other thing. I'm glad. Another reason you need to make sure you do that. Well, one qualifier: if you're on a group plan, and you've got a minimum essential coverage, you don't need to worry about that. You can stay on that plan and continue on for until you lose that coverage. But if you are eligible for Medicare and you don't sign up, then you're getting into penalties, and that you don't want to get into that section.
I actually had a guy one time that he was in his 80s.
Yes.
He had never signed up, and he was living out of the country for a while. He came back, and the cost was in the thousands of dollars for him to sign up for Medicare.
Wow.
Unbelievable. I never saw anything like it, but it's true. That's a rarity, but obviously that can happen.
Another reason you want to talk to your agent.
it's a highly complicated process. And I was joking with Jeff, and I said, I went to an insurance seminar. I won't say the company, but a similar kind of companies. And we had a lovely dinner. Lots of clinicians were there, and they educated us significantly on the different services and plans. And they then gave us all a parting gift to go home and read in our leisure. And I want to say that I grew up in the 80s, and in every home there was what we refer to as a yellow pages, a yellow book. Yep. And if you grew up then, you knew that this book was like this thick. You could fight somebody with this book if you had to. And they gave each one of us a book like that. And I was floored, because I had heard conversations amongst my close people or relatives and family that were in this process. And I thought to myself, who is reading this? Nobody's reading this. It's a ton of information that the average individual will never see or understand, or be able to process how to utilize it. So I'm sure you get a lot of phone calls that are like, I just need some information. I don't want somebody to call me 50 times. I don't know what I'm doing. I just want some information. And you were saying earlier, they can do that. How do they reach out to you? Where are you located out of?
Our office address is 1120 20th Place, and it's right, basically 11th Avenue, State Road 60 westbound, just before the railroad track. So we're got a big
sounds like the beginning of an Arlo Guthrie song.
That's right.
Right?
City of New Orleans. Right?
We share a parking lot with what used to be the patio, 19th hole.
Yes,
used to be Sammy's, now Nick's. So we're right there in that corner of 11th.
That's a pretty iconic corner. People know it.
Yep, 11th Avenue and State Road 60. And phone number is 772-562-4900. 4477.
Oh,
So
that's
our
wonderful. So they can reach
number.
out locally. They can get
Yes.
some information. It's
Yes.
no cost to get the knowledge that you need to make good choices and decisions that will in turn help you hopefully avoid both a health care and financial
Correct.
problem in the future. So I love that. I love that the two can be combined and recognizing how one can impact the other. And being preventative can protect one and both the other. So that's an important thing to share in our community across our Treasure Coast. There are options out there. You don't have to pay to get the information. No. There are individuals just like Jeff and the McCall Agency who want you to understand the options that are provided to you. So I encourage you, reach out to Jeff, educate yourself, go on to their website, take a look at what they offer you. I am sure that you can find local symposiums and seminars on the YouTube. I'm sure you all have links to such information as well. And then when you have those questions, reach back out, touch base, and formulate them and get the answers you need so that you can be on top of the ball for your health and your wealth. What would you say before we begin to wrap it up? What is the number one pitfall that can be avoided by coming to an agent like yourself?
I would say to avoid any emergency. I mean, again, if you, even temporary coverage, you can get temporary coverage instead of the full coverage, but you just want to make sure you don't, any catastrophic event. And again, you've got your coverage in place. It's not that difficult to, like I said, at a minimum, we just talk and advise, and when the next open enrollment comes up.
Yeah, one of the reasons I brought Jeff on board was the fact that I've known Jeff for a pretty long time now, and one of the things about Jeff is that he is as honest can be. So if you want to get the straight skinny on healthcare, you're going to get it from Jeff.
I want to get the straight skinny. I also want to get the info on healthcare.
But and if you don't know when you're going to turn 65, I mean, you'll know because in your mailbox will be full of flyers and everybody wanting to get your business.
Yeah.
You'll be inundated by that, so much so that it'll probably freeze you up and say, I don't know where I want to go. So that's why Jeff's here, because Jeff will tell you what's in your best interest, and that's exactly what you want to hear. So get a hold of Jeff. He's the guy, and he'll set you straight.
And he's local for 40 years here in Indian River County, and you are actively utilizing your knowledge from the past financial as an investor, as a banker, and recognizing how important it is to find balance when people are making choices for their healthcare policies as well.
One more thing we need to mention, and we haven't mentioned it yet, is that Jeff not only does personal individual insurance, which is his bread and butter, but he's also very much involved with group insurance.
Oh, wow. Okay. Wonderful.
So could you tell us a little bit about group,
yes,
how that works?
And that's a whole other animal, but at the same token, we concentrate on 4 to 50. They quote, the definition of small group is 4 to 50 employees. So if you're an employer out there looking for something to induce your employees or to hire employees, that's one way to do it.
Yeah, entice
Keep them happy. You don't want to lose them, so you want to retain them. But these plans are, relatively speaking, affordable, and you want to get, again, it's the same thing. You do a full review of the coverage and then make sure that it fits the needs of the employees. And if you don't, the backdrop to that, or the fallback, is always do the individual side.
But one of the things I found working a lot with 401k plans for companies and such is that most employers here, certainly in Indian River Coach, really think a lot of their employees. Yes. And they're trying to help them as best they can. So, and a healthcare plan is one of the best things that they can do to keep good employees and to help their employees, which is, I think, what they want. So.
I think so too. As a young woman, I worked in mom and pop shops, amazing people. They wanted their employees to be cared for. They wanted them to have the same coverage that they and their families had. And there was a lot of conversations, but it just simply wasn't affordable for them as a company to subsidize and bring that in. But yet you're seeing more and more companies in that range. Listen, it's a lot to pack into 24 minutes. I thank you, Jeff, for coming and joining us and trying to educate our group a little bit. The silver lining in the story is there's free information out there. Call Jeff, learn a little something. It can't hurt you, and it might make a big difference in your future. Yeah. So on that note, we will see you next week for additional silver linings. We thank you for joining us, and I'll see you then.